Alright, so you've just had your hair transplant surgery. Here in a snapshot is exactly what you need to do for the next 14 days. Today is day 0. The first thing you're going to be doing is you're going to be sprinkling your grafts every hour, on the hour, set a timer to your phone. It's 10 sprays all the way across the transplanted area only. Alright, so we're now day 1 post-surgery. You sprinkled your grafts throughout the night. You're going to keep sprinkling it throughout the day. At 4:30 p.m. in the afternoon, you're going to remove the bandages that we placed on the back and sides of your head. And if you notice any residual bleeding, you're going to apply some firm compression with the swabs that I've packed in the bag for you. This is just to mitigate any more bleeding. After that, you discard in the bin. Day 2, you're just going to keep sprinkling your grafts throughout the day, every hour, to keep the area nice and hydrated. You're now at day 3 post-surgery. On this day, in the morning, you're going to take some of the baby shampoo that we've packed into the bag for you. You're going to put this into the bottom of a jug or a bowl, a good dollop. Take the sponge. You're going to put some on the sponge as well. You're going to dip it into the jug or bowl. You're going to generate a lovely lather out of it. Position yourself in front of a wash basin, tilt your head back and squeeze onto the recipient area. Do the same thing with the donor area. It's a non-contact wash. The sponge never touches the head. You'll find that I'll get you to rehearse this at the end of the day to make sure that never happens. Once the area has been soaked for a couple of minutes, you're going to take 2 fresh jugs of lukewarm water, tilt your head back and gently pour onto the recipient area and onto the donor area. You repeat the non-contact wash again on day 4. Day 5 is your first contact wash. And I repeat, the sponge never touches the head. But again, with the baby shampoo, you're going to take this, put it into the bottom of a jug or a bowl, and you're going to use the sponge to generate a beautiful lather out of it. So really give it a good squeeze. Again, you can put some of the shampoo on the sponge to help generate that lather. So beautiful lather. Again, position yourself in front of a wash basin, tilt your head back, gently squeeze from about 10 centimeters away onto the recipient and the donor side. This time, you're going to use your fingertips and you're lightly going to dab, 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 and do the same thing on the back, very gently for about 30 seconds. I also want you to do some very light circular motions. The idea is to sit there ripping the scabs off, but gently caressing. Do that for a further 30 seconds. Allow it to soak for about a minute, and then you're going to rinse through with 2 to 3 fresh jugs of lukewarm water. You keep doing this process up until day 10 to 14, by which point all of the scabs should largely be off the head. That's your aftercare. There will be some antibiotics that we give you subject to your consultation, and there will be some mild painkillers that you'll be given too. I would like you to use an aeroplane cushion. So a lot of questions that people ask me surrounding aftercare is, how do I sleep? You're going to have a little bit of swelling which tracks down your face. You want gravity to work. So I'll give you an aeroplane cushion, you wrap it around your neck, you're going to sleep in an upright position. Swelling generally peaks at day 3. One of my patients famously coined it the avatar stage. That is what you will typically look like. And by about day 5 or day 6, that swelling will generally go away. Make sure you use the aeroplane cushion. And that's your aftercare.